which are the first 2 weeks of April, the likelihood of them being discussed, I'm not saying that all of those proposals they can be accepted, but the likelihood of them being discussed, that increases. And that's why the importance of this timing. Now, the initiative that Wasif has taken, and Wasif, Wasim Janjua, and our friends from Vital Strategy, Khurram, and all others, they have been working on, and I would say they have been working very consistently on these issues for last many years. And every year, when they start their campaign on tobacco taxation and tobacco control, I wonder that how creative they will be and from where they will get new ideas. And for 2025, this is an excellent idea, having a tobacco control knowledge hub and this policy dashboard where one can see the trends, the data, what is working, what's not working at one place. And this actually fits very well with the work that Dr. Sajid Amin and his team is actually doing. They are working on data for development and evidence-based decision making. So yet another dashboard for decision makers and tobacco control. I think that would add value to the work that we have been doing so far. This knowledge hub will serve as a platform for engagement, for collaboration, for advocacy, and facilitating meaningful discussions. Very often we and many of us who have activists inside us, we perhaps make claims, we demand actions, and the counter argument is where is the evidence behind it? Where is the data? And I think if we have something like this knowledge hub, where we can have one window for or one stop for all such data, that would be important. And I congratulate Wasif for this important initiative, and I thank Khurram Saab and the team for their continued support in it. The second important is the tobacco taxation. We have been talking of tobacco taxation, and this year's budget, I remember last month I was approached by Pakistan Dairy Association, who wanted to gain STPI support for withdrawal of this heavy GST on packaged milk. And their this request was that packaged milk is not luxury. The provision of safe drinking milk is one of the fundamental rights of every child and everyone. So they said that the GST which is imposed on packaged milk, due to which even the loose milk is actually being sold at a higher price, that should go. Now, I took them to one of the policymakers, and the policymakers asked them, he said that we are already behind the IMF revenue target. So if we withdraw this GST, from where we will be able to match the revenue? And the immediate response of some of the representatives was that why not to increase more tax on tobacco? That would help you in reducing your health budget. That would fill in the gap of this some of the lost revenue. So not only us sitting in this room, we are talking of this tobacco taxation, but even the other industries and other sectors, they are also now looking at the rationale of why to increase duties and taxation on tobacco, so that if I have to choose as a policymaker between providing safe milk to the people vis-a-vis imposing taxes on tobacco, so what should be the rational choice? I think rational choice is very clear. We need to discourage the duties on some of the sectors like dairy, and we need to increase taxation on some of the harmful sectors which have clear health impacts and which can be source of revenue like tobacco taxation. So again, I think this demand is very timely, and one is looking forward to all the recommendations that would come from this discussion. I can promise that we will take all these recommendations to the newly appointed Federal Minister for Health. We'll request them to be our ambassador and take these recommendations to Ministry of Finance. Provided these recommendations, they are data-based and evidence-based. And I'm especially grateful to Dr. Naran Teo. Am I pronouncing it? Trying to pronounce it. Yeah, Dr. Nara, Pakistan's country lead for WHO, for leadership and dedication to tobacco control. And I also thanks Dr. Matiur Rahman Saab, Mr. Syed Ali Hassan, and all others who have joined us. May I request Dr. Sajid Amin to keep on representing STPI management here. I'll be joining you online. I'm sorry I have to rush for another meeting, but I wanted to come here and to express my solidarity for the cause of tobacco taxation and tobacco control. Thank you very much.
Assalamu alaikum ji. I've been told that I have to get my name here. Thank you. There was a special instruction that please get your nameplate in the picture. They are documenting that who attended and who didn't. Let me begin by joining my Executive Director, Dr. Abid Suleri, in welcoming all of you on this side of the table and on this side of the table to SDPI. And I think without taking name events that it's all of you are fighting a cause, the tobacco control in terms of Pakistan's one of the biggest health challenges that Pakistan faces are the drinks and the tobacco. And also I think this is such a niche area. It's only your passion that can take you to this area. The drive for funding and others would miss this area because the development partners other than WHO and some others are not bringing much on. So I really appreciate the journey that you have been in the long through this tobacco control in Pakistan. So I know this is Ramzan and we are left with 45 minutes to close. So I'll just give 3 quick points on this one, and this is particularly on tobacco taxation. I'm not a health expert, and all of you know much better than me even tobacco taxation. So my messages will be to government if they can reach. I mean, there's sometimes very hard to reach to the government, but as a think tanks, our job is to continue repeating the messages. Maybe somebody listens some part of it. I think there are discussions going which are quite an opposite to what we are discussing. I mean, we are discussing to increase taxation, but the FBR is proposing a reversal on the taxation, and that we need to reduce taxes on tobacco, sweets, and real estate. So there is a proposal from FBR already. So my point is that this comes from when you see taxation as a revenue policy. So the first message I think that we need to give from this forum to FBR, that while it is bringing you some rupees, some money, but this is the residual part. Tobacco taxation is for tobacco control. So in this way, I think instead of reversing tobacco taxation, FBR need to do 3 things in upcoming budget. Number 1, it should clearly document that taxation is for tobacco control. it should be cited and it should be written in its documents. It should not be seen as a revenue generation tool. Instead, it is a revenue tobacco control tool. So that is, I think, first recommendation that should go from this forum. The second is also the unified taxation on tobaccos. Again, this two-tier system or the tiered system is coming from when you see tobacco taxation as a revenue. So there you are sensitive to what will happen to the activity, what will happen to the, we call it a Laffer curve. If you high tax people reduce the consumption of tobacco and FBR gets lower taxes. So the FBR need to focus the first part that people are reducing tobacco consumption. The revenue part should not be the guiding rule on tobacco or taxation. So that I think, and this is where the tiered system comes then. When you are seeing revenue as a end outcome of tobacco taxation, so you are focused on tiered systems. For example, you have some sort of low taxation on locally produced cigarettes, second tier cigarettes. But to me, they are the most dangerous to health actually, in terms of quality, in terms of affordability, because if local cigarettes are more affordable and a larger chunk of population is using local tobacco, they should be taxed more actually than even the tier one. But this only comes when you have a health as a goal of tobacco taxation. So I think that is the second message that should go from this forum, that tobacco taxation is a public health policy, not a taxation policy. And that is the message to the government and Ministry of Finance as well, that Ministry of Finance should not treat it as its revenue tool, instead maximizing the public health in this one. And my third and last point here, in terms of knowledge hub, I think when I was reading concept note, it looks more a repository of the research that's been. I'm sure this is the first step. This should be the beginning process. But I think this should act as a forum, as a platform to generate this debate continuously, not only bringing what is available on tobacco and tobacco taxation and all this one, but also creating this dialogue that you are starting at a more systematic and more robust basis. With all these three messages, I welcome you, all of you, and Dr. Nara, I'll take the easy part. I won't try to pronounce your name, so I'll take the easier part. So I welcome Dr. Mati, Dr. Abid Slari has gone, Sayyid Ali Hassan, we have Wasim Sahab, we have two Wasims, we call Wasimin. We call Wasimin. So there are two effective Wasims. And I am thankful and congratulations to the whole team, which is really implementing this very much needed niche that's really missing, not only in SDPI, in most of the development sector. Also, I see a very beautiful picture of my friend Asif Saab, joined from Karachi. Sir, you always look so energetic, so good to see you. You are giving us a sense that you are not fasting, you are so fresh and looking always. So back to you, Asif. Thank you.
Thank you very much, sir, for such lively discussion right at the beginning. I would request Dr. Wasim Iftikhar Janju if you can come up with your presentation, but you are very short of time, as you know, right?
So tobacco track and trace system, which was imposed in Pakistan in 2022 July. We have been running this system for almost 3 years now. Without giving you the details, because both Article 15 of FCTC as well as the protocol, they mandate the countries, and Pakistan is a signatory to both of them, of course. They mandate that we need to have a track and trace system, and track and trace system is basically on 4 or 5 sectors, which is pharmaceutical, cement, these fertilizers, and tobacco, just to mention 4 of them. The main, I'll simply skip all these slides and go onto the system, how it works. So you can see that the red portions here, they are showing the tobacco and tobacco industry's supply chain. In the middle, you can see the tobacco factory. They put up a demand for every year to the government of Pakistan, that is FBR, for a particular number of cigarettes that they're going to produce. And on the left-hand side, you can see the tobacco taxation stamp. As per the demand, the government issues charges them the tax and issues these stamps. They then go, and on the top you can see the stamp is being placed on the tobacco product or the pack of cigarette. Then that pack goes into the warehouses where they are put into the cartons. Then the cartons need to have the stamp, and then they are put into the master boxes. Again, another stamp on that, and then the pallet. So there are almost 4 stamps which are supposed to be placed on any tobacco product. Then they go to the distribution channels, and then they go to the retail market. Within this system, you'll see the black arrows pointing downwards. All this data is constantly it needs to be transmitted to the government in primary repository and then to the secondary repository. On the right, extreme right-hand side, you can see the customers. And customers, when they buy, on the lower portion, you will see there is an app by FBR which is known as Transact. So anyone can download on your smartphones. You can download this app and you can scan the barcode or this stamp on any pack of cigarette and find out if it is a fake, if the tax has been paid or not, or if it is genuine or it's smuggled or it's illicit or what's going on that. So this Transact has a very interesting function to play. Basically, tobacco industry wanted to spoil this, and they identified their own track and trace system, which was known as Codentify, but then it failed. They applied it for a short duration in France, but then it failed. I'll keep skipping, and I'll go to recommendations. First thing is that this system needs to be under strict control of the government. And no other body or no third party needs to, provide this. But sometimes we cannot produce these systems, so we have actually imported this. Real-time data sharing is very important. If you allow, I just wanted to discuss this slide. Now you see the 2 production lines, one on the right side and one on the left side. It's in the same factory. The importance of track and trace system is that it should place a stamp on every single cigarette which is produced or box in which it is boxed. But what happens is that all those which are being produced, for example, on the left side for export, they do not receive in Pakistan. And but as a consequence, they end up again in the market, and as a result, there is smuggled or there is illicit. So this is, very quickly, I understand that we are already late by, so every single pack needs to be, and everything which is going abroad, because there is one global example, Ecuador, in which track and trace system failed because they were not placing the stamps on the export quality. Again, media advocacy and.
Sir, I'm cognizant of the fact that it's very important. I don't want you to miss anything which is important. You can take another 2-3 minutes.
That's all right. Yeah. But I just wanted to explain this in more detail, but this is functioning. My most important recommendation is that it needs to be implemented. And what tobacco industry is doing is that they are buying a particular number and they are paying for those the withholding tax. But what happens is that when they are producing it for export, they are not placing stamps on those. And what happens is that through other channels, back doors, that product lands up in the market, and then industry cries out that it's an illicit market or it's heavily occupied by the illicit or smuggled cigarettes. So that is what it was. Thank you so very much. I'm sorry. Yeah.
Thank you very much for these very valuable recommendations. And I usually call your presentation as an agenda setting presentation most of the times. Before inviting the next speaker, let me thank Dr. Sajid Amin for joining us today, because he has to represent SDPI at a very important forum. He has to join, I think, US Embassy probably. So thank you very much, sir, once again. On agenda, I remain busy. Thank you. So Now I would request Dr. Wasim Salim if he can, add value to the discussion by his remarks.
Thank you so much. I, I, I like to thank SDPI for arranging this very important talk at a very particular important time when there's an IMF mission here is in Pakistan, and there is already a discussion going on about some reduction in the tobacco tax rates. Uh, so it's important to build some counter narrative in the for the masses to understand what is the problem, why we are discussing. We move 2 steps forward, then we take 4 steps backward, and we are still at the same position. We are not with a sustained tobacco tax policy, and WHO is working closely with government, particularly with FPR, and our main point is to have a long-term sustained tobacco tax policy, and we are hoping that this will happen soon. So as we all familiar that the main purpose of FED on cigarettes is that it serves 2 objectives simultaneously. First, it's generate revenues for the government, but more importantly, it reduce the harmful use of tobacco, which is one of the major risk factor for the non-communicable disease in Pakistan. And today in Pakistan, or more than 50% deaths are due to NCDs. And tobacco is the most important risk factor that cause NCDs. As Mr. Sajid Amin has mentioned, I try to answer his first question. This is actually the problem with our at a policy level also. FED, federal excise duty, is not a revenue thing. Its main objective is to discourage the consumption of harmful products. It's not for the revenue generation. So it's according to FBR also. They imposed FED on those products for whom or for which they want that their consumption should be restricted or curbed. For example, in our electricity intensive products are also have an FED. The main purpose is to discourage the consumption of such products. So the tobacco and SSBs are the classic examples. It has nothing to do with the revenue generation, but unfortunately, because of weak tax enforcement and administration, we always missed our revenue targets, and then we look at these products and see that maybe we can easily get a lot of revenues. So FBR, although they believe that this FED is only to discourage the consumption of a product, but they always talk about that they are not getting sufficient revenues, and those revenues are not because we are having a huge tax rates. They are just because industry is manipulating and control these revenues primarily. So the annual economic cost to the economy due to the smoking is around 770 billion rupees. This is huge. This is only 20% of this we are recovering from FED and GST on tobacco. One more clarification: industry always portray that they are paying taxes, they are highly paying tax sector. These are indirect taxes which are paid by the consumer, not industries paying out of their profits. So it's simply shifted to the consumer, and consumer is paying. So the industry is just a middleman. They are just collecting it from the consumer and deposit it to the FPR, which they are not doing correctly. There are a lot of issues with that also. So in recent past, we had story starts from 2019-20 when there is we revert back from 3 tier to 2 tier, and then till 2021-2022 the FED rates were stagnant and fixed to these rates, and then within a year FBR has raised the FED on cigarettes 3 times in June 2023, then 2022, then in August 2022, and then a large increase in February 2023, which resulted almost a 200% increase in FED in 1 year, which shows that the share of FED or the indirect taxes in the total retail price has increased significantly from 51% to 60% in case of economy brands, from 65% to 81% in case of premium brands. WHO recommends a standard tobacco tax rate of 75% is the minimum if you want to ensure sustainable revenues and discourage the consumption. So we are still, when we look at the average is around 63 or 64% because we have a dominant market of economy brands with the share of around 90%. So the average is still below the WHO recommended level. As I started, that it serves the dual objectives that higher taxes generate more revenues and discourage consumption. Unfortunately, we don't have any consumption's official numbers because of certain reasons. But the one factor is well-established fact is the largest component of the domestic consumption is the domestic local production. So the legal production. So we can see that after this huge tax increase in February 2023, we have seen almost 40% decline in the legal production by the industry. So which shows that consumption will decline. So if it's the largest portion of the total consumption and it is declining, then the overall consumption will also decline. On the other side, government revenues are increasing. So before the supplementary finance bill of February, the average revenue collection was 95 billion, and after that it went up to 152 billion. So important to note, production declined by 42%, but at the same time the revenues has increased for the government. So it shows that it's a clear evidence that increasing the tax rates, you generate more revenues and consumption will decline. So it gives the overall picture that industry portrays that there is a huge increase in the tax rates, and I think that maybe we are reached to above all the levels. But just look at this table. In 2015, today in 23-24, we are at same level where we were in 2015-16. At that time, tobacco tax revenue collection share in total indirect taxes was around 6%. Then it starts to fall down, and now again after almost 8 or 9 years, we reach at 6.2%. So we are not reached or above that level. We are at the same level where we were almost 9 or 10 years ago. Just to give you an idea where we stand when we compare with some neighboring countries, you can see we are still, even after this huge tax increase, at the same time, because our currency was depreciated heavily, so we are still at the lowest end of in terms of excise duty amount on 100 packs of the most sold popular cigarette brands, we are still at the lowest side. We are just collecting $36 per 100 packs of cigarettes in terms of FED. Where just look at where the Sri Lanka stays, where the Philippines, where India is almost getting double, and Bangladesh. Indirect tax share is now slightly went up from 51.8% to 63%. So why, on the one side, one simple question, that the share of indirect taxes is almost very close to the neighboring countries, but our revenues are not as high as others are. I'll explain this shortly. So these are the few tobacco industry myths or arguments that you will find when you discuss with or read in the media, or you discuss with FBR or the industry also. So they say that cigarette prices are too high. For this reason, smokers seek cheaper or illicit cigarettes. Tobacco taxation will have a huge negative impact on the economy. So if you try to discourage, the growth will go on, or maybe there will be huge employment loss to the economy. Small unregistered companies evade taxes. So the argument that the share of the illegal sector is too big, and they are evading taxes, and the legal sector is paying taxes according to their liabilities. Cigarettes are expensive in Pakistan as compared to other regions. I already showed this thing. So now just look at these. We have experienced this thing in 2016-17 when just look at where we were in 2014-15. The average annual production was around 62.7 billion sticks, and the revenue collection was 81.9. Then in that time, since 2013-14 to 2015-16, there was a continuous increase in the FED rates. And in 2015-16, the production declined to 53.5 billion, and the revenues were around 90.5 billion. Then in 2016-17, industry reported that their production has further decreased to 34 billion sticks, and the revenues fall to 66 billion. At that time, FBR got panicked and they decided to reduce the FED rates on cigarettes by introducing a third tier. And what happened in 2017-18? And the idea was that you will reduce the tax rates, the tax base will increase, the illicit will knock down, and the proportion of the tax-paying cigarettes will increase, and people will switch back to the consumption of these tax-paid cigarettes. And tax was reduced significantly. So now look what happened in 2017. The production recovered to 2014-15 level almost, but where were our revenues? Our revenues were stuck at 66 billion. So, and today you are listening the same argument from the industry, that the entire market is taken up by the illicit sector, and if you're going to reduce the tax rates, the revenues will recover. This will never happen. At least our past shows that this never happened in the past. And now I'll show you that where we are, and this situation and where we are right now is the almost similar situation. Again, look at the impact on the economy. If we look the size of the sector in terms of the crop sectors, in raw tobacco share in the total crop sector is 0.42%. Then in agriculture employment, it's 0.03%. Look at where the industry stands. Share of industry in total output is only 1%. Share in industrial employment, 0.3%. So it's not that big sector when you look at in terms of its contribution to the economy. A study by SPDC found that if we shut down this sector, there will be first order effects, and then the long-term effect will be redirectional effects, which will have a positive impact on the economy, because the consumption people will, this sector has a small multiplier effect.
Doctor,
And
you
this
have
consumption,
last 60 seconds.
okay. So the consumption will reroute it to more effective and productive and with a multiplier effect sectors. This based on 2015-16 Pakistan Bureau of Statistics census data. The share of small sector is only 8.7%. It's not that big as industry claims. This slide shows the problem is The 45% is the legal tax paid sector. 47% is the underreported by this legal sector, and 8% is the illegal or informal trade based on 2015-16 government official data sets. So I just want to discuss with you trends in the production and FED revenue during July, December. What creates this panic within FBR? Just look at these numbers, that in 2023-24, we had a 15 billion sticks produced, and the FED revenue during the first 6 months was around 105 billion. So the average FED collected at that time was 7 rupees per stick. And 2014-15, although the production has increased to 18 billion, so it's almost 20% growth in the production, but the revenue are showing slight decline. And it's not because that something is happening or the illegal sector is growing, because the production is showing a growth in the market, but because industry is tried to put a pressure on the FBR and they reduce the production of the premium brands. What Dr. Sajid was mentioning, that this tier system is creating a problem. Yes, it is creating a problem, because now industry initially has reduced the production of their premium brands. Just look at this number. In 22-23, during the first 6 months, July to December, the estimated production of the premium brand was around 4 billion sticks, and the estimated revenue was around 25 billion, and its share in the total tobacco revenues was 40%. In 23-24, where the production was at the lowest level, industry produced 2.7 billion sticks, and the revenue share of premium brands in the total tobacco revenues was around 42%. And in 24-25, it has decreased to only 19.4%. So what industry has done, that they have reduced the production of the premium brands and they are producing more economy brands, where the average FED on the economy brand is lower, and it creates a lot of panic within FBR.
Excellent, sir.
I'll stop there.
Thank you very much, sir, for sharing these very important numbers. You are, I mean, you'll admit the fact that we are short of time. Just to summarize that, you emphasized on a couple of things, including that Pakistan lacks data primarily. Then there is a tier shifting issue, and then tier system itself is a problem, and then Pakistan is lowest in terms of paying FED or imposing FED taxes. With this, I would now request Dr. Matiur Rahman, who is the head of Tobacco Control Institute at Health Services Academy. Sir, we are short of time, so I'll only be able to give you 4 minutes.
Let me introduce myself. I am basically professor of pulmonology. That is why smoke and smoke-related diseases are very near to my heart. I lost my father at a very young age. So that is another reason that, because he was a chain smoker. Very excellent discussion. So many things brought out. I think hardly anything left for me to say, but just to make, because there are 2 points, so I'll just summarily go one by one. First of all, very good point as a professor, as a researcher. Again, I will have to think that why we do not have an evidence-based things. Evidence is produced by researchers, and researchers are non-existent, let me tell you, in tobacco industry, because the sponsorship of the other part is higher than for those who want to bring the picture real. So once there is no research, there is no evidence. And once there is no evidence, whatever we are doing is just beating around the bushes. So we are not having a solid policies, solid strategies, which are the requirement of a treaty which we have signed. So what's first thing is this. And it is very clearly, very recently, WHO document has shown that policy implementation, we are very high, 88%. But as far as the basically progress in developing or improving the policy is only 65%. So that's another thing to think of. We have to understand things as well. we are not only double, triple, but triple country as far as smoke is concerned. Number one, we are in dire shortage of dollars. We need a lot of revenues. Certainly, yes, we need. But at what cost? Have we done any research that the taxes which we are collecting very high, how much we are investing on taking care of the health of the people? There is a big dichotomy. FBR thinks that collecting tax is to just increase revenue. It is not. The basic purpose of the increasing revenue is to discourage smoking. It's not VAT. It is a duty or tax to reduce the consumption. If we are suggesting now that we should reduce, so what are we doing? We are trying to make availability of a cheaper cigarette. So certainly we are increasing the number of smokers and resulting in a large public money on managing those people who will have problem of the smoking related disease. But again, we have to understand that Pakistan is a tobacco growing country. So we have also sit together and find and develop a strategy how to see or how to support those who are growing tobacco and having their living from that. And this has been practiced for in other countries. So we don't have to reinvent the wheel. Now the second, the third point is that the tobacco control is under 3 ministries. Is there a relation in between 3 ministries? That's a big question mark. One ministry is supposed to increase tobacco. We know that the Pakistan Tobacco Board, which is one of the, is supposed to increase the revenue by taxing the raw tobacco. Others are taxing the prepared or the finished product. So this is one thing which I wanted to say, that multi-sectorial involvement should be done. We have to involve multi-sectorally, and we have to let the FBR understand that this tax collection is not only for revenue, is basically to save the health of the people. Now, there is a very big gap. We are taxing, and we must tax and keep on taxing on cigarettes, but a very big chunk, the new, Nave Daur da Nawa Tamasha. What about the nicotine products? What about the Naswar? It is scot-free. The costliest thing at the moment is not the cigarette, is the e-cigar, 10,000 one. So why we shall not tax on that? Before taxing that, we have worked a lot. In fact, I ran from pillar to post, from province to province, to convince the DRAP that please register these products. And for that, we have to get the analysis, and you'll be surprised that after a lot of difficulty, we could get analysis of only few products. So this is very important that we all those who are in the way where they should join together, and they should bring the hazards of nicotine products as well, which are more harmful than only cigarettes. So as because the time is short, and a professor, when he starts talking, stop, very difficult to stop. But I must thank my Vice Chancellor, Dr. Shahzad Ali Khan. In fact, I am representing him. He was invited, but he is very much heavily committed in ministry meetings. So he asked me to, because I am working under him as Dean of Allied Healthcare Sciences, as well as Patient Safety and Quality of Care Department, and lung diseases, because I am Professor of Pulmonology and Tobacco Control Department. So thank you very much for intently listening.
Sir, we are honored to have your presence here, and thank you very much. And I'm really embarrassed that we are not being able to accommodate you in terms of time. We have speakers online as well, and then we have scheduled a briefing on Tobacco Control Knowledge Hub. With this, I would now request Mr. Syed Ali Ahsan to please share his remarks.
Well, thank you for this opportunity. I'm actually quite relieved that we don't have to talk at length about this issue, because I will be representing maybe a slightly unpopular opinion here. So the government of and I'm representing Dr. Ali Salman here. Dr. Ali Salman is a member of the committee of the government on revenue leakages that are the result of illicit tobacco production, manufacturing, and smuggling. And so we are part of these discussions. That committee is well represented by the private sector as well, by the legal entities in the private sector and other think tanks and experts. So when it comes to the wisdom of imposing taxation on tobacco as a means to control the consumption of tobacco, that is something that, of course, getting a plethora of researchers that are commenting on how effective it is. But what we have seen is that the it is not something that has led to any medium or short-term results. So whatever is going to happen as a result of the convergence of maybe several policies over the long run that might lead to the intended outcomes that are desired by the anti-tobacco lobby. Now, the government of Pakistan is losing about 300 billion rupees of revenue as a result of illicit manufacture and smuggling of tobacco. In a recent study that was done by Saqib Shirani, he proposed that, or at least he found out that the price elasticity of tobacco products, legal tobacco products, is -1.4. That means it's more than proportional. This statistic itself, I think, is a major cause of concern for the government, which thinks that very soon now we'll be coming to a point where we will start losing money and start losing revenues from tobacco, absolute revenues I'm talking about. At the same time, we have about only 44% of the consumed tobacco in the country is now being produced by legal companies that are in the tax net, companies that are adhering to the different laws and regulations that the government provides. So now the government is at a crossroads. It has to think about whether it wants to discourage tobacco consumption, which it has maybe arguably done so, but most of the demand has actually shifted to the illicit sector. And so whether you would want to have more problems to deal with at any given point in time, that is something that the government wants to do. If you talk about economics, which is what we represent at the Policy Research Institute of Market Economy, we feel that there is really not much that you can do about the Laffer curve. You will increase the tax rates and the revenues from tobacco will go down, and the leftover demand or the original demand will go towards the illicit sector. And so what we're going to end up having, if we have an aggressive tobacco tax increase policy, is going to have a much larger illicit sector, and the government will lose out on revenues, and it will not have the money to enforce the different controls that it needs to enforce on illicit tobacco as well. So this is a tricky situation. And in 2022, the government decided to raise the taxes on tobacco by about 217%. So that's a very large shift in the price, and it has led to some consequences which are unintended. I don't think anybody expected in this room to have essentially promoted the illicit sector. And that is something that Prime does not encourage either. So there are several ways to curb tobacco demand. Taxes may be one of them, but more holistic policy is advised. And if you talk about incentives and what the government is going to respond to, the government responds to money, especially a government that is short on resources. It's going to prioritize money over all other outcomes. At the same time, this conversation that whether these taxes are there to discourage consumption or to mitigate or curb the externalities of tobacco consumption, that also needs to be cleared out. because at a certain, I mean, it is quite clear that the government is not willing to be super aggressive on tobacco control. You know, there are ways that the government controls products that it does not want consumed. So whatever negotiation, whatever contract has evolved over the last few decades between the government, between the international agencies, between the local players, it is maybe not suitable for the goals and objectives that many of the people representing the anti-tobacco side of things are concerned. So, I mean, I would close there. I know we're short on time, but if you're going to talk, if you're going to use an economic policy tool to derive a social outcome, then you must know that the economic policy tool is going to do what it's going to do. The Laffer curve will come into play. It has already come into play. And if it didn't, the government would not be proposing a reduction in taxes. It is unusual, but at the same time, what is also not the best is to stick to a policy which we don't know when it will succeed.
Right.
And so that needs to be looked into. Thank you very much.
Thank you very much, Sayyid Ali Hassan Saab, for your valuable insights and representing the viewpoint of Prime Institute. Uh, Basically, I'm not a very, basically, I'm not an economist and I'm not very fan of this Laffer curve theory, but still, it would be looked at in a different way. So now I would request Mr. Asif Iqbal, who's the Managing Director of SPDC. Sir, the floor is yours and the time is really in front of you.
Well, thank you very much. So I think because you have Iftar there, so I'll be brief, but I think I'll just make one point. First of all, I think there is no evidence of saying that there is a Laffer curve there in the case of Pakistan, because there is the production has not declined. There has an production, as Mr. Wasim has said, the production has increased by 18%. So this argument to me is invalid, and I think we should have, because this is a policy dialogue, so we should have another dialogue on this. And the second thing is that when we talk about, of course, now the tobacco industry and FBR, they are kind of confusing two things. One is tax policy and one is tax administration. So these two are different things. So let's coming back to the illicit thing, and it has been said in the newspaper for the last few days or so, 2 weeks, I think, that the illicit trade in Pakistan is 54%. And this was based on a survey by Institute of Public Opinion and Research, which conducted a retail survey. So first of all, it's not a scientific survey that they have been done. And number two, the way the things have, the results have been produced or communicated is very misleading, because the survey focused on the availability of various brands instead of consumption of cigarettes. So basically, the survey does not take into account the market share of these brands. For example, when we say that 300 out of 500 brands are illicit, it doesn't mean anything if we don't know the market share. So a brand that is available in the market but has a negligible share in the actual consumption, so it cannot be considered a significant contributor to the illicit trade. Just to give an example, SPDC did a study in last year on tobacco consumption. So Pakistani cigarette market is highly concentrated. We have top 15 brands. They constitute 80% of the total market. And top 5 companies have a collective share of 72%. So what we found in that survey, and that survey was, it's a nationally representative survey based on the sampling framework done by the Pakistan Bureau of Statistics. And we interviewed more than 5,000 smokers. So the illicit trade, what we found is primarily driven by the locally manufacturing cigarette, which accounts for 21.3% of the market. And additionally, smuggled cigarettes, they contribute to 11.9%. So it's like 33% of the market. And this is based on a rigorous survey, a nationally represented survey. So, of course, and we also have a study on elasticity. I would request you to visit our website, and it's there as well. So, I just, because I have a lot of things to say, but given the time, I think what we need to see is evidence is there. And we have seen the same survey, what we have seen 25, there was a question asked to the smokers. This is my last point. The question was asked to the smokers that is there any change in your consumption after the prices were enormously increased in February 2023? So 24.5% of the smokers said they had reduced their consumption. So the intensity was reduced. And overall estimate, what we saw was that there was a decline of 19.2% in aggregate consumption of cigarettes, and that includes, I mean, it's total consumption, illicit and illicit. So I think that there is a need to have a more dialogue on the evidence, that what kind of evidence is being generated and what kind of evidence, how it is being kind of propagated and how it is communicated. When you say that 300 brands out of 500 brands, for example, are illicit, and if you don't know what is the share of that brand, it doesn't mean anything. So I'm sorry to be loud, but I think we need more discussion on that. Thank you very much.
Thank you very much, Asif Saab. Probably I'm not doing justice with time because we have a lot of discussion on the subject, but the time is too short. But I really promise you that I'm going to conduct another session on the same subject in next week, and we'll request you again for your interventions. And for that session, I would request all other colleagues who have joined us today to join us there as well to, I mean, discuss it further, and we can make it more clear in terms of, I mean, suggestions for the government. With this, I would now request Dr. Wasim once again for a 1-minute briefing on Tobacco Control Knowledge Hub, which is the first ever Tobacco Control Knowledge Hub, and we are formally launching it today with this policy discussion.
So very briefly, I'll introduce the concept behind this. Since all of us are aware that there are almost 9 knowledge hubs operating around the world. For example, in India, we have smokeless tobacco products knowledge hub. We have Article 5.3 in Thammasat. We have legal knowledge hub in McCabe, Australia. We have tobacco taxation knowledge hub in South Africa, etc. And we wanted a place where we could, conduct these kind of policy discussions. We could generate, collect and collate the evidence for our partners to be used. Because I understand that not only in Pakistan, but in entire AMRO region, that is Eastern Mediterranean region, which includes all the Middle East and going all the way to Morocco, there is a real serious shortage of tobacco control knowledge being created and being collated or being used or reused. So that was the basic concept behind this. And now I would request Wasif to give a quick demonstration of the knowledge hub that we have created. And we promise you that we'll continue populating it further with your support, help, and with our own, research and other initiatives. Thank you.
I leave it to the discretion of the users, but it can be accessed at knowledgehub.stpi.org. This is the landing page, and you can find the publication section, news section, which will be updated on daily basis by Radma. Radma has put in a lot of efforts. Basically, it's her effort which is evident in front of you in terms of this web page, and she'll keep on populating with her. We have Ismail and other colleagues who have designed the web page and then put in a lot of efforts for populating it and managing the data initially. and I expect it to be populated further in terms of time as we go on. Khurram Hashmi Saab is here, who has, given us a lot of guidelines in light of other international resources which are available in the different parts of world. With this brief introduction, I come to the last part of today's session, and that is the vote of thanks by Dr. Nara, who's the cluster lead of disease control at WHO Pakistan office. Over to you, Dr. Nara.
Okay, thank you. Thank you very much, and I'm very honored to be here and listen to your discussions. I'm very new to Pakistan, just about 3 months here, but I have very good staff who are working in this area on tobacco taxation and policy, like Dr. Wasim and Mr. Shakhsat. I'm sure you know all of them. And thank you for inviting WHO to this dialogue, to this meeting. And for this, from your discussions, you mostly were talking about the economic cost in regards to tobacco control, but from WHO side also, we are talking about the human cost. Especially in Pakistan, we is the country which is really double burdened with communicable and non-communicable diseases. And as you know, tobacco is one of the very big risk factors for NCDs. In like about more than 800,000 people annually die because of NCDs. I think WHO did some also investment case for tobacco policy, and this investment case, I'm not sure whether you know about this case, but it is publicly available. Maybe in this knowledge hub you already downloaded this investment case. It's good source where you can also see tobacco taxation, how can it can improve the human cost. You know, it's like reducing the number of deaths and reducing the cost that spent for the health services for who patients who suffer from non-communicable diseases caused by tobacco. I mean, these numbers you can read from this investment case, and it also shows savings from workplace productivity losses as well due to tobacco use. As per Tobacco Control Knowledge Hub, I hope that this knowledge hub will be really centralized database for as a repository for all the evidence which will show the benefits of the tobacco control in Pakistan, not only in Pakistan but also some examples from other countries as well. As well as I think it should be a collaborative platform for policymakers, researchers, civil society, even public as well. And it can be also some type of capacity building center where can provide some training on best practices for tobacco taxation and policy implementation and enforcement, as well as a monitoring and advocacy tool to track tobacco industry tactics, yeah, and policy compliance. I think mostly these tobacco knowledge hubs, they're moving to this direction, and this our Pakistan hub, I hope it will be really very comprehensive knowledge hub where everyone can get information regarding the tobacco taxation and tobacco policy. Thank you very much. And finally, I would like really thank all partners, all those who involved or friends kind of WHO who are working towards increasing the tobacco tax in Pakistan, and in the long run, we will really reduce the morbidity and mortality due to NCDs. Thank you very much.
Thank you very much, Dr. Nara. Now it's time for iftar. I think we can go outside at the terrace and have our iftar things. Thank you very much once again.
Thank you.